This video is very hard to watch, but we need to discuss it. Now, I've been both the doctor taking care of patients in this situation and the patient in the wheelchair. With my second and third kids, I came into labor and delivery, booming labor, excruciating pain, and I was treated very differently than this patient was. First, from a purely medical perspective, we're trained, doctors and nurses, to triage patients to understand what is a true medical emergency. When can you sit there casually filling out your electronic medical record, and when do you need to haul ass to take care of someone? Like if a patient came in with a gunshot wound, you would not manage them this way with your back turned, not examining them, taking all the time in the world. People in, especially labor and delivery, the emergency room, are taught to multitask also. It is not uncommon for them to be asking questions of the patient or their family member if the patient can't answer questions, while also simultaneously, getting vital signs, putting in a line, doing an exam. So this patient who has had children before is saying several times that she feels like the baby is in her butt, which if you have one day on labor and delivery, you already know that that means the baby is coming out. The mother of this patient also said they initially went to the ER entrance and was told, this is just for ambulances, you got to go to the front entrance. Again, imagine somebody with a gunshot wound being told that. You would not be like, hey, you got to get to that front entrance. They would bring them in. They would take care of the patient. The implication here is they do not believe this woman is enough of an emergency. She's not in enough pain that she needs immediate care or pain medication. She's not in far enough labor that they need to get her immediately to a delivery room in order to assess her and her baby. And we know from many research studies that Black patients are treated differently. They are perceived to be exaggerating their pain. They are less likely to be offered pain medication when they are in objectively painful situations. This is at least part of why we have a Black maternal mortality crisis in this country. If you've heard, for instance, Serena Williams giving her story of how she diagnosed her own PE, pulmonary embolism, after having a baby. She had a history of PEs. She knew what the symptoms were, and she literally was begging her nurses to get care. And the nurses didn't believe her. It took several times that she had to advocate for herself. And this is one of the most famous women in the world who has access to the best medical care. I also need to point out how the healthcare system has created this scenario where someone's looking at a computer and not at the human being suffering in front of them. This is not at all to excuse her behavior, but I'm sure in her mind she's thinking, well, I got to check off all these boxes, otherwise I'm going to get into trouble. She actually even says, I can't bring you to a room until I've registered you and gotten you a wristband, which again is not true. Like if you had a gunshot wound, you'd be whisking them in. Everyone who works in healthcare has faced the emails, the reminders from administrators, you got to do this module, you got to fill this out. If you don't do it, then the hospital's not going to get paid for things. So this is a system problem as well, where we've kind of moved away from the let's put our focus on the patient and more on we got to tick all the boxes and fill out the computer forms. Otherwise, the administrator is going to get mad at us. So I'm so sorry to this patient and her family. I'm glad it sounds like she and the baby are doing well, but we really owe it to them to learn a lesson from this story and try and improve our systems, how we care for people, how we show empathy, and how we respond both as healthcare providers and as human beings.